Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. Hi everyone. Today I am your special guest. Don't have a special guest to interview. This is a topic that I feel I want to cover. So if you've been an attentive follower and listener, we have been doing a lovely series on birth options. And if you haven't watched them yet and you're preparing for your birth, please go look back and empower yourself. They are incredible stories and you will learn so much. This episode is brought to you by Pegasus Homeopathics. Pegasus is a trusted household name that provides safe and effective remedies for everyday ailments and little pregnancy niggles. The good news is that it's 100% safe during pregnancy and for babies. Visit www.pegasuskids.com. So when it comes to birth, oftentimes, as much as we plan and have our options and have everything in place, things just happen. And also, things can go not as planned. So now the follow-up series that we're busy with is when things don't go as planned. And you will find a few different birth scenarios that hasn't gone as planned. So today, I want to talk about birth before arrival. Now, what does that mean? In our medical world, we call it BBAs. That's birth before arrival. When you work in a hospital and the baby comes in mom's arms, then we know this baby's been born somewhere along the lines before they arrived at the hospital or the birthing facility. Now, that is really everyone's worst nightmare, right? If you've planned your birth, whether you go to the hospital or you're going to a birth center or even at home, and the baby arrives unannounced and as a surprise without the arrival of either your midwife or your doctor to help you with that process. That can be extremely stressful as well. But we've all heard those stories, right? Like I know a few stories of people that have been saying, yeah, my baby was born on the road, or before, even for me as a midwife, before the midwife has arrived, or just as you're busy giving birth, then the midwife arrives. So things like that does happen. Even in hospitals, we've heard stories that the baby just popped out while the midwife or the doctor weren't in the room. So the bottom line of this is that babies come when they're ready to come. And if they want to come, there's nothing you can do to stop them to come out, right? They come like a big poo. If I can say it like that, there's no way that you can hold them up. And we wish that all babies do come out that easy, right? If you've had a difficult birth, you can't imagine that. So today, I just want to give you a little bit of a few steps on what to do if you ever find yourself in that situation. If it's not for yourself, then it's for a friend or a family. So birth, as I said, is never the same. And you've got to be prepared for anything that happens. Birth is also something that's very natural and it's something that your body does. So the more we are allowing our body to do what it does, and if you're very relaxed, and oftentimes, especially those moms that have been very well prepared, that are very much in control and relaxed, those are the ones that the babies actually can come very fast because their body is just in the perfect environment for this process to go smooth. So if you are in a very relaxed state of mind and the hormones are all flowing and working and so forth, then birth just happens. That is the beauty of it. All right. Then another thing that I want to point out is that, yes, every birth is different, but we also see often quite a difference with the first birth or subsequent births. So those are quite different scenarios. With a first birth, we often actually find that women arrive too soon into their birth facility or their hospital, and then they have this long waiting game. Because first-time babies tend to just take longer. They're making the way. Your body hasn't done this before. You're also more alert for every contraction that is coming, like, hey, things are happening. And then with the second or third time round, you've learned your lesson, your body's more prepared, you're more calm, and then once the contractions start happening, things can actually go quite fast as well. So that is a thing to remember. If it's your second or third time baby, then don't apply the same rules as with your first baby. Things can go a bit faster. So how can you prepare for this? Well, this is also good for your birth partner to listen to, because he's going to maybe really be the one that's going to be freaked out the most. So he also needs to know what to do. So first of all, it is always important to know who you're going to call as soon as baby's out. Where you need to have your care plan in place, obviously. So if you have been on your way to the hospital and it happens in the car, I'm going to tell you what to do just now. But then obviously you're just going to carry on after baby's out to the hospital to where you were supposed to give birth, and they can do the rest. If you are a home birth mommy and the midwife has come too late, then the midwife will speedily arrive. She's probably been on her way or something. So then someone is on their way. But just make sure that you know who to call on as soon as that baby is out, to make sure that the aftermath happens also smoothly and that you get the help on time. So, but if this baby is wanting to come and there's no way you're going to keep it in, then number one is to stay calm, right? Birth always needs to stay calm. Panic is never good for birth. All right, because in your calm state, your body knows exactly what to do, and the placenta is there to do its work. It gives the baby all the oxygen that it needs, so the baby won't be in distress. The more you breathe and relax, the more you help the baby to also be completely healthy and relaxed. All right, so calmness is important. Don't freak out. Easier said than done, but remember these words: stay calm. Then just keep listening to your body. As you know that this baby has come this far without, your body's just done it, and now this baby wants to come out, you just carry on letting your body do what it does best, and the body knows how to get a baby out. I keep saying this, and it helps a lot of women, that if a woman is in a coma, she can give birth. So birth is like something that happens in our intuitive brain, more our old brain, they call it, or the animal brain. It's not so much in our cortex brain where we think. So as much as we can, we need to try to stay in that intuitive brain and space. And that is the best space to be for the baby to come out, okay? So listen to your body. And also, if you do that, you will automatically go into a position that feels just natural, that feels best for baby to come out. And that will most likely be either you want to stand up, be upright, or you want to be on all fours, or squatting. Those are the most natural positions that your body wants to take to get a baby out, which is also really the position that creates most space for baby to come out easy. Then remember when that head wants to come out, and that's especially true when it's a second or third or fourth baby, then those powers in your body can be so intense and the baby can come out so fast that the head just wants to come out quickly. And you need to be very controlled here. All right. So that is where you're going to breathe the baby out. And this is really important information also when you are with your care provider. So take note. This is for everyone. This is how we give birth, women. So once that baby is ready to come out and you feel it's very intense, and you feel the head is crowning, and you almost feel that burning sensation of your skin that is starting to stretch up, then you want to imagine that you don't want to tear, right? No one wants to tear. So you're going to keep breathing. You breathe the head out by then. Don't give it a massive push. So you can actually breathe the head out in that last final stage. And imagine just that the skin is sliding over baby's head. All right. And then if the baby doesn't want to come straight away, then you wait for the next contraction. Then the whole body will come out. So you basically just the baby will come out, and then obviously super important is to not let it drop. So we sometimes say, we talk about catching a baby, but if it goes fast and a baby is wet and slippery, that's sometimes literally a catch. So someone need to be there, either yourself to get the baby out, or your partner to get that baby out and not drop it wherever you are positioned. And then all you do is you get it through the birthing channel, and you get your baby here on your stomach or on your chest, depending on the cord. All right. So that is important, is just to stay calm, listen to your body, catch the baby yourself or the partner. And then once the baby's out, keep it skin to skin, on your skin. That is a natural resuscitation space for baby. That's where baby can recover, and where it stays warm, where it has a thermoregulation from you. So that's super important, skin to skin. And then dry the baby, okay? A baby is completely wet when it comes out, and the worst would be in this situation is that baby goes and drop temperature. And obviously a baby will drop temperature very quickly because it's got a small surface body comparing to the skin surface, and it is wet. So a baby can't generate heat itself yet, so we need to keep baby warm. So make sure that you dry baby and cover it while it's skin to skin. And then that's it, hey? You keep the baby on the skin, and just get to where you need to go, or make sure that your healthcare provider is around you. Don't cut the cord. I think that is a thing that we've always been taught back in the day when it comes to birth for dummies, is that you need to get those scissors or your shoelaces and tie the cord and then cut it somehow. Well, that is not evidence-based anymore. So don't stress about the cord. In fact, it's better if you keep the cord intact. Because what happens is that cord, the umbilical cord, is still attached to the placenta, and the placenta is still attached to your womb, and it's still functioning. So even if the baby is maybe recovering from birth a little bit, the placenta is still giving baby oxygen, and it's still maintaining good oxygenation. So that is incredible how birth has been designed to just make this transition go smooth for baby. Now, if we cut it instantly, then that function is not happening anymore. Then obviously the blood flow is not coming from the placenta anymore. And then baby miss out on that benefit. Also, we know that it's really good for baby to still get all baby's blood into its own body. And don't worry, the blood won't run out from baby to the placenta. It doesn't work like that. So all blood will come, placenta will work, and the blood will go into baby. So keep the cord intact, and keep baby skin to skin, and then you get to the healthcare provider. They will normally help you with getting the placenta out. That is quite, if it comes by itself, it will also come, but it's not like a baby that you can't keep it in. Normally a placenta you actually can keep in, because obviously not as like full on as a baby. So, but yeah, if you feel the placenta wants to come out, there's nothing you can do about it, and the uterus is busy expelling it, by all means do that. It's just very important that you still get it checked out, that we make sure that everything has come out, because we don't want parts to be left behind. Because if that happens, then you are more at risk for bleeding. All right. So that is really birth in a nutshell. If this ever happens to you, then this is what you do. You stay calm, you listen to your body, take the position that you feel is the most natural, breathe the baby out if it really wants to come super fast, use your contractions, and then catch the baby, put it skin to skin, and keep the cord intact. If you know this, then you are already way more knowledgeable than every average Joe on the street. So be informed with that. All right, so then a few things that that you might find is obviously, that can be an emergency, right? So if the cord is around the neck, if you feel like the baby doesn't want to come out or only the head, and the cord is around the neck, well, normally what you can do then is actually just loosen the cord a little bit, and that's where someone needs to help you and just get the cord over the neck. It is quite normal for babies to have a cord around the neck. It happens in some instances. It's not a reason for a Caesar, don't worry. We get a lot of babies with a cord around the neck. Most of the time it's quite loose, and then the body, if you can just get it over the head. If it's very tight, then it's most unlikely that you would have had this easy birth all along, I would imagine, because it sometimes keeps the baby from engaging and going deeper, right? So we're not going to go into too much detail on all the what ifs. Most of the time, these babies that floop out are just those easy births where everything has gone smooth, and they just needed to come out. So that is birth in a nutshell for you. And again, if you listen to this is good for everyone that is going to give birth to know these basics, because these are birth basics for every birth to go well. But if you find yourself on your own, then this is what you do. All right. Then I just want to say a few words of something that concerns me, okay? And that is that there is this whole thing out there going on about free birthing. And maybe you are one of those that are considering it, or you are one of those that have never heard of that and think people might be crazy. But I'm telling you that it's a thing that's happening out there, that women decide to give birth all by themselves without a healthcare provider, because they've now learned all these things and know how birth works, and they think they can do it on their own. And yes, you can do it on your own, and you do birth on your own, and that's what we're all about, and empowering women that they own their birth and that they can do it, and that is as least intervention as possible. But please take my advice as a very experienced midwife that we never know how birth goes. And as much as the majority of births go very well if we let it be, there are always instances that you do need a professional that knows what to do, and that is can be life-saving for you in that moment and for baby. I am not an advocate for free birthing. I think it's a wrong trend. I hear the plea of women that they want better births and less medicalized and intervention and all of that. And we are working hard to train midwives to facilitate those births, to have better birth options and solutions, less intervention, less medicalization. And even, I'm all for home births where you can have it in your own environment. But also there, a home birth is only safe when you are low risk woman and when you have a professional that knows what to do when something don't go well. And also when you have access to emergency care in a rather close proximity. So be wise, own your birth, but be wise. All right. No free birthing. That I think is pushing the boundaries a bit too far. So let us find balance in our birthing world. I would love to see less babies birth before arrival. It's a thing that happens a lot in very rural environments where women really wait way too long for transport to get to the hospitals. And I would love to see that go down. Because we do see complications that were preventable if the transport was sooner. So I would not want any woman actually to be all by herself or with a partner with a birth before arrival of a healthcare professional, a birth worker. I hope this was helpful and that you enjoyed this. And we are going to tackle a few more stories of when things don't go as planned. So stay tuned. Thank you so much. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.